Hi, I'm Dr. Kurt Wohler for Sunrise Functional Medicine. The title of this short video is the vitamin D blood spot, or the vitamin D blood spot test. So here's our disclaimer, understanding that this information is for educational purposes only. So the vitamin D blood spot, this is a test that comes from Mosaic Diagnostics, and it provides a direct assessment of vitamin D levels. People often ask me, well, how much vitamin D do I take? And there's some general reference ranges out there, of amounts to take for the average adult or child, for example. But the best way to know, honestly, how much vitamin D you need, or perhaps your child needs, is to measure. So this test is performed via a blood spot, which is a finger prick test. So it's basically a dried blood spot off of a finger prick. And again, it measures directly the amount of vitamin D, and then provides reference ranges for severe deficiency, moderate deficiency, what's sometimes called suboptimal levels, as well as optimal ranges, and then elevated ranges. So here's an example of a vitamin D blood spot test from Mosaic. And as we can see in this particular individual, their level is really more in that suboptimal range. Ideally, we'd like to see levels of around 50 nanograms per ml, somewhere in there. Some people have a reference range in between 50 to 70 or 50 to 80, but generally around 50 from most sources you read within the functional integrative medicine world is kind of a target for most people. So the vitamin D test is really done best at least twice a year. It could be done more often. You could do it every 4 months, for example, to really get an accurate measurement as you're dosing vitamin D to see where the optimal level is for you. The one thing to remember about the vitamin D blood spot test is it doesn't indicate or diagnose a toxic health condition or a disease that might be linked to a high or low vitamin D state. It just is giving you the level. So the test is used solely to identify a current level of vitamin D. And one of the things about vitamin D supplementation is that if you stop taking it, your levels can drop, fairly quickly. And some people, it may even be within a few weeks. So again, the best way to know how much vitamin D you need and where your levels are is to test. So one place you can actually access the vitamin D blood spot test on your own is through Lab Test Plus. So this is a website that provides access to certain functional and integrative medicine testing. So you can go to labtestplus.com for more information about the labs offered through that website. If you'd like more information about our consulting practice, you can go to our website at mysunrisecenter.com. You can also email us at scmedicalcenter@gmail.com, and there's the phone number on the screen. So again, I'm Dr. Kurt Wohler for Sunrise Functional Medicine. Thank you.